So get vaccinated. That was the big takeaway from the group chat hosted by Boise Mayor Lauren McLean. As with most COVID press briefings involving healthcare professionals these days, it's still our best shot at getting a handle on the spread of the COVID-19 and its variants. And even with breakthrough cases, studies and medical professionals tell us it is the best way to keep symptoms to a minimum. Mild cases instead of severe, asymptomatic instead of, well, admitted to a hospital, depending on the person, of course. And that is why back on July 8th, all three of Idaho's largest healthcare providers, the same who got together today, made it a requirement for all employees to get the COVID-19 vaccine in order to remain employed. And that would apply to the thousands of employees at St. Alphonsus and St. Luke's health systems and Primary Health. And those employees have until next month to fulfill that requirement. Well, almost immediately, the protests began. Press conferences and pep rallies, complete with people holding signs saying what these companies are demanding is un-American and certainly not the Idaho way by taking away the freedom of choice. And those involved with the press conferences and rallies wanted Idaho lawmakers to get involved, for the legislature to make it illegal for a private business to require a vaccine of its employees. Legislative leaders have said that's likely not going to happen because, well, that would be a slippery slope of government getting involved in private business. Certainly not the policy of the majority party in Idaho, the GOP. But at the last anti-vaccine requirement rally that was held Monday on the State House steps, organizers changed their tact a bit. Before, it was a my body, my choice approach. This week, it was about money, claiming those hospitals making this vaccine requirement aren't actually private businesses at all.
They receive tens of millions of dollars in tax breaks and tax relief. They receive hundreds of millions of dollars in Medicaid expenditures, both from the state and the federal government. To call them a private entity misses the point. They are a quasi-public agency, and we have absolutely every right to tie conditions to those dollars.
That was Representative Ron Nate, who was a speaker at that rally. And the question is that the case? Are privately owned or nonprofit healthcare providers like Primary Health, St. Alphonsus, or St. Luke's quasi-public agencies? Well, here's what St. Luke's had to say about that. An ag subsidy to an Idaho farmer doesn't make him or her a public entity. It's an illogical conclusion. As for the reimbursement we receive through Medicare and Medicaid, Representative Nate knows the reimbursement we receive is payment for the services we provide to beneficiaries of those programs. To characterize it any other way is incorrect. So no, participation in a government program does not make that entity a government entity any more than you are for receiving a federal stimulus check. And as of right now, those private employers are sticking with their employee vaccine requirements, and Idaho's lawmakers aren't willing to try to change that.